Hi there, science fans. Welcome to another episode of Science and Other Stuff for Senior Citizens. In this episode, I will discuss atrial fibrillation, or AFib, and its consequences. This video is a response to a comment by a follower whose father was recently diagnosed with AFib, and he requested that I do a video on this subject. So let's get started. So what is AFib? AFib is a type of irregular heart rhythm. During AFib, the atria, the upper chambers of the heart, quiver chaotically, resulting in an irregular and often rapid heartbeat. This heart rhythm is caused by specific nerve bundles located in specialized cardiac cells that regulate the normal rhythm of the heart. One critical result of arrhythmia is the prevention of the heart to pump blood throughout the body, increasing the risk of stroke as well as increasing the risk of heart failure. Before going further, let's look at a portion of the heart's anatomy. The heart is made up mainly of 4 chambers, called the right and left atrium, and 2 lower chambers called the right and left ventricles. The atria contract or squeeze blood to the ventricles, which then pumps oxygenated blood to the brain and to the rest of the body, and also pumps deoxygenated blood to the lungs to pick up oxygen and release carbon dioxide. This is diagrammatically shown in panel A. The diagram on the right traces the electrical path responsible for normal heartbeats. The cardiac cells located at the sinoatrial node, or SA node, depolarize, sending an electrical signal to the AV, or atrioventricular node, resulting in the contraction of the atria. That signal is then carried through the bundle of His and other nerve bundles, causing the ventricles to contract, resulting in the pumping of blood throughout the body. One result of irregular signaling from the SA node is atrial fibrillation. This slide shows some of the symptoms of AFib. They include heart palpitations or increased heart rate, irregular heartbeat, difficulty breathing, weakness, dizziness, chest pain or discomfort, or fatigue. Some individuals do not present any of these symptoms of AFib and are unaware that an event has occurred. AFib is usually diagnosed by a simple electrocardiogram test that measures electrical signals in your heart. This slide shows a normal and AFib EKG tracings. The normal tracing indicates periodicity throughout the EKG, while the AFib readout is quite chaotic, and even an untrained eye could distinguish irregular and erratic rhythm. I've selected a portion of the normal readout that is bordered by a red box and blown up in panel B to show the P wave, the QRS complex, and the T wave. The P wave indicates atrial depolarization, which occurs in the SA node cardiac cells prior to the electrical signal to the AV node. This wave represents the contracting of the atria and pumping of the blood to the ventricles. The QRS complex represents the repolarization or relaxation of the atria signified by Q. The RS complex represents depolarization or contracting of the ventricles, while the T wave is a ventricular repolarization or relaxing of the ventricle. The QRS-T function signifies the pumping of the blood to the rest of the body. Much information is contained in the EKG tracing, but I will only describe that if someone is interested in another video. Leave a comment if there is further interest. This slide represents some possible causes for induction of AFib in an individual. You can study these and determine if they apply to your particular health issues. If so, I would recommend seeing a cardiologist to consult for your severity of risk and to collaborate with to develop a prevention strategy. This slide also describes AFib risk factors. If you suffer from these risks, a plan with your cardiologist would reduce the probability of AFib. However, many individuals lack symptoms and don't recognize the symptoms, which confirms the recommendation for consulting with a cardiologist. One can see that the risk of AFib is greatly increased as we age, so the elderly should be seeing a cardiologist, even if we consider ourselves healthy. Not all is lost because there are several good tests available to help the cardiologist in developing a prevention plan. They include the EKG test previously mentioned, a heart catheterization test that determines whether the heart coronary arteries have any blockage requiring remediation, an echocardiogram, which is a test that uses sound waves to visualize the functioning heart, including the heart valves, heart size, and most importantly, calculates the ejection fraction. The ejection fraction provides the cardiologist with information of the heart's ability to pump. A stress test is also helpful to determine the heart's pumping function, as well as blood tests. There are markers in the blood that can inform whether the heart is healthy or is in heart failure. This slide describes why it is necessary to know whether your heart is in rhythm and healthy. Those who are elderly and had below normal or low ejection fractions are at a high risk of developing strokes and heart attack. See a cardiologist. This slide shows the main treatment goals determined by your cardiologist. The patient should work in combination with the cardiologist as a teammate and a collaborator. If a primary cause of the development of AFib is related to an underlying health condition, treatment of that condition by proper medication would be part of the treatment regimen. There are a host of medications and medical devices that can be prescribed to maintain normal heart rhythm, including pacemakers, beta blockers, drugs that can regulate rhythm, and of course, blood thinners to reduce the probability of a stroke. Electrocardioversion is a procedure in which an electric current is used to reset the heart's rhythm back to its regular pattern. A catheter ablation is most often done using a thin, flexible catheter inserted in the heart that uses heat or cold energy to create tiny scars in the heart to block abnormal electrical signals to restore the normal heart rhythm. Surgical ablation removes a layer of heart tissue to block abnormal electrical signals to restore a normal heart rhythm. This slide recommends some lifestyle modification that could lead to a healthier cardiovascular system. Stay safe. The pandemic is still raging, so vaccinate to reduce COVID's severe outcomes. If you like these videos, please click the like button and subscribe to the channel. Don't forget to click the bell to be notified of upcoming videos. Bye.